Bernie Sanders dropped his Medicare For All bill this week, which predictably has stirred up a slew of bad faith attacks from the Trump administration. Trump press secretary Sarah Huckabee Sanders claimed that self-proclaimed socialist Senator Bernie Sanders is proposing a total government takeover of healthcare that would actually hurt seniors, eliminate private health insurance for 180 million Americans, and cripple our economy and future generations with unprecedented debt. Whew. Okay, so that's one sentence, 4 healthcare corrections that are needed. Let's do this. First, when she says total government takeover, what she's talking about is moving away from private, employer-based insurance. This is a good thing for several reasons. Bernie Sanders' insurance plan cuts spending on healthcare by $2 trillion. And it does that in part by getting rid of the middleman, the insurance companies, who spend millions of dollars on advertising and other efficiencies, and most importantly, on profit. The point of Medicare for All isn't to profit from people's pain and provide tens of millions of dollars of salary to corporate CEOs. Those savings, along with prescription drug savings, are passed on to the American people. It's also important to note that employer-based insurance is unnecessarily cruel. You need to work to get health care, but if you get really sick, you can't work. What kind of sense does that make? Healthcare is a human right. And whether you live or die from an illness shouldn't depend on your wealth or your employment status or whether you can afford a high copay or high deductibles. That's inhumane. As Dr. King once said, of all the inequalities that exist, the injustice in healthcare is the most shocking and inhuman. People like their doctors, but they do not like their insurance companies, no matter how much cable news pundits insist that's the case. Being sick is stressful enough without spending time arguing with companies who profit from coming up with ways to deny you coverage. The only people you should have to talk to when you're ill are healthcare professionals. Medicare for All wouldn't hurt seniors. It's quite the opposite. It would expand the benefits they already get under Medicare to include vision, hearing, and dental services. Third, the fear-mongering about how Bernie wants to, quote, eliminate private health insurance is a total red herring. There is no equivalence between Sanders' plan to cover every single American and Trump's plan, which doesn't exist. He just wants to strip insurance from millions of Americans by getting rid of the Affordable Care Act without providing any alternative. Don't believe me? Google it. There is no Republican plan. They've got bupkis. The thing is, the people who really care about eliminating private health insurance, the people who are invested, are the ones making money hand over fist by charging us high premiums, ridiculous deductibles, and astronomical copays. Medicare for All wouldn't cripple our economy. Medicare for All costs $2 trillion less than what we currently pay for a system that doesn't even adequately insure all of us. As Bernie says, we can't afford not to switch away from our current system. Medicare for All won't result in hospital closures. It will stem the flood of closures that are happening now because medical care wasn't deemed profitable enough in certain sparsely populated areas. And we won't have longer wait times. Countries like Germany and the Netherlands have public health care systems, and they have comparable wait times to ours for non-emergency surgeries and specialist visits. And quality of care under Bernie's plan will improve. Right now, American women are 50% more likely to die in childbirth than our mothers, and life expectancies are actually declining. This in the richest country in the world. We're paying twice as much as similar countries and getting half the value. Americans deserve better. Medicare for All opponents like to talk about choice, but the only choice being protected by them is the choice of insurance companies not to cover you. You don't have a choice when you can't afford the treatments your doctor prescribes. You don't have a choice when you're a stay-at-home parent and you lose your insurance because your partner passes away. No one would choose that, and we don't have to put up with it.